Good evening, everyone. I hope you are all doing fine in this post-COVID situations and all. Get yourself vaccinated if there are no other contraindications. I am Dr. Thrimurthulu. I'm a consultant dermatologist. I'm practicing at Sri Lasya Hospital, Kakinada, which is located in Andhra Pradesh. Today here I'm going to brief you about urticaria, also called as hives, and I'm going to tell you what are the symptoms, signs, what are the triggers, what are the common types, and what are the other subtypes, and how to get rid of them, and how to or when to consult a dermatologist. You must have all gone through certain periods of time in your life where you had raised lesions on your skin, which are usually you must have ignored them as bed bugs or bed bites or insect bites. They come and go, they are transient, short-lived, they are for 2 or 3 hours and they disappear on you from your body. They are the ones which are called as urticaria. In common language, we call them as hives. Urticaria or hives are very common. They affect 20%, 20 to 30% of population, especially in Indian population. It is rising. The number is rising. Usually after a heavy exercise or stress, maybe your lack of sleep, or you're facing a lot of stress in your day-to-day life, or maybe you had a alcohol bout, a weekend you have heavy pints of alcohol, or maybe you had some physical trauma or some skin itching or maybe scratching, you had developed red lesions all over that area. These are the signs and these are the triggers or maybe common triggers that the patient tells us when they have raised lesions all over their skin. The hives are very easy to diagnose. When you touch them, the center of the hive, you touch it and you have a typical blanching. There is a red color that turns into white when you press with your finger. That is a blanching sign. We can find out whether it is urticaria or anything else. Urticaria are usually short-lived. In less than 24 hours, your red bumps or hives, they disappear. Sometimes they stay for more than 24 hours. Then you should suspect some vasculitis and consult a dermatologist. What are the symptoms and signs of urticaria? Symptoms, usually you had some food allergies or maybe drug allergies, or maybe you had a new dress, or maybe you went some journey, or you ate some outside food, or you had some emotional stress. Some 3 or 4 days you are under a lot of stress. You had a physical exercise which starts suddenly and you did some 1 or 2 hours of gym workout. Suddenly your body reacts and releases a lot of histamine, and that histamine causes some raised regions on the body, the bumps on the body. These are the typical feature that the patients tell us when they come with urticaria. The symptoms are usually short-lived and they stay for 24 hours. Sometimes they stay for more than 1 day. Then you're supposed to diagnose and investigate. The next most important point is urticaria can occur anywhere on the body. Urticaria can occur anywhere on the body, starting from head to toe. When it occurs on the face, you should be very careful because there's a chance of swelling of the eyes, swelling of the lips. Sometimes you can get some respiratory distress, or there's a feeling of choking in the throat. That is a medical emergency. You should run to the doctor or emergency room immediately. What are the common triggers that you can have this allergy or this urticaria or the hives? The common term is hives. So the triggers that the most patients tell us is food. The most common food allergy is peanuts, groundnuts, peanuts, sometimes seafood, or the patients even nowadays they're telling about using of this turmeric, or drinking turmeric with milk. And sometimes even patients tell us about the very common ingredients in the diet, such as most of the patients tell us about brinjal and the seafood, or maybe some nuts, peanuts, groundnuts. Coconut allergy also can be there. You should always look for food allergy. Once you had a food allergy in your life, there's always a chance that food can always cause a recurrent allergy. In the next episode, whenever after 2 months or 3 months you had the same food, there's a chance of developing the allergy. Wheat, nowadays you should find out gluten sensitivity, whether you are sensitive to gluten. That also can cause red bumps all over the body. And the next one is medications. The medications, most common medication the patient tells us about complaining of allergy is brufen, the painkillers. Then the latex allergy can be there. The contact allergy to new dress or new type of clothing or maybe footwear, they can the chance of developing an allergy. The next one is blood transfusions. Sometimes the patients undergo blood transfusion and they develop allergy. There is a chance of allergy developing along the area of trauma, physical stimuli. You take a pen and you write it on the skin without, means like you use the sharp end of the pen and try to stroke the skin, and you have that lines coming. That is called dermographism, that is skin writing. You can write on the skin. Physical urticaria it is called as. Some people even complain of allergies or urticaria after shower, like cold shower or maybe hot bath with hot water. They develop all over the body some red bumps which go away within few minutes. There's a chance your bacterial infections, certain bacterial infections or certain viral infections, they can cause urticaria. Pets are very common source of allergies, especially in children. You know, the dog fur, the Pomeranians and all, they cause lot of allergy. Pollens are very common in winter season. There's a chance that you can develop allergy. Hay fever, that causes fever like rhinitis. You have sneezing, recurrent sneezing, all of the body become red. That can be also one of the triggers. And whenever you're going walking, early morning walking or early morning jogging, on either side of the road there are certain plants. When you come touch it with them, there's a chance that you can develop red lesions at that point of contact. All these things should be kept in mind before you go to the doctor. What caused your red bumps? That should be kept in mind before you proceed further. What are the types? Acute urticaria, chronic urticaria. And there are so many types of urticaria depending upon how it is caused, like cold urticaria, hot urticaria, cholinergic urticaria that is called as, physical urticaria, dermographism that is called as, or some urticaria induced by food or pseudo additives in the food, like colors in the food, or sometimes urticaria caused by medications, or urticaria caused by infections, viral urticarias. So you should always classify broadly urticaria into two types. Acute, which is lasting less than 6 weeks, or more than 6 weeks, you call it as chronic. Whenever somebody is going into chronic and it's last, I have seen patients coming with urticaria from the last 1 month or few days to 1 year, 2 years, 3 years, and even 10 years also. The chronic urticaria where there is no particular cause, which call them as chronic idiopathic urticaria, or as CIU, chronic idiopathic or chronic spontaneous urticaria, that has to be treated by a qualified dermatologist. In physical urticaria, the physical cause is rubbing or scratching or stroking the skin. So there's always a chance that stimulus, the scratch or constriction, you wear a tight shirt or tight some bandage, or there's a chance that entire area becomes red and swollen. Physical urticaria. You take a warm hot water bath or cold water bath, there's a chance that entire body can become red. That is stimulus to cold and hot. That is called as cholinergic urticaria. There's a chance that you can also have urticaria exposure to sun. That is called solar urticaria. Solar urticaria is very common nowadays, and you should always wear a protective sunscreen and consult a doctor in due course. How do you prevent urticaria? One of the most common things that I tell the patient is maintain a food diary. What are you eating daily? Is it any junk food or outside food or processed food, or a lot of additives in the food? Especially these Ajinomotos and all, lot of additives or colors or artificial flavors, all these things can cause allergies. Also make a note of what tablets or what medication you are using, especially during the course of your entire preceding 2 months before your onset of urticaria. Any viral infections, any fungal infections, or any sore throats, or maybe you had some history of taking of NSAIDs, painkillers for headache and all these triggers should be noted down. And the food diary should be maintained for at least a period of 1 month, so that you can understand the pattern of eating, and also better note down your emotional stress, like lack of sleep in the last 1 week. For 2 days you have not slept properly. Next day morning you had a few lesions on the body and they disappeared within 1 hour. So you should inform your doctor about all these things, so that the treatment protocol can be tailored according to that. Most of the urticarias are not life-threatening, except for angioedema, where there is a swelling of the lips and there can be respiratory distress. That has to be taken very seriously, and you should meet the doctor immediately. But in other cases of urticaria, usually it is very treatable, and sometimes it can become chronic and can be irritating and frustrating for you. You should always take the help of a qualified dermatologist and get yourself rid of the urticaria. Usually your doctor or dermatologist orders few investigations like the AEC counts and IgE levels, and find out what your allergy level is or what is the cause of your urticaria or hives, and treat accordingly. Always believe in a qualified doctor and get yourself treated. All the best. Thank you so much.